It's a shot at controlling the pandemic. COVID-19 injections are continuing in France, although the supply problems are affecting centres like this. And for doctors, the issues are clear to see.
On va pas assez vite, on devrait vacciner beaucoup plus de personnes maintenant.
We're not going fast enough. We should have vaccinated many more people. We depend on how many doses the labs send to the EU that are then sent to us in France. We had a goal by the end of February to vaccinate 4 million people, but the way it's going now, we'll probably be around 2.5 million.
De février, on pourra en vacciner, je crois que 2 500 000.
France was criticised earlier in the year for the slow pace of its vaccine efforts. And now the supply chain issues are forcing the staff to adapt once again.
When we first opened the centre, we were ready to vaccinate 900 people per day. Since then, the government informed us that we would only have 420 doses a day. So we had to rethink our planning. The people that were supposed to have their vaccine soon are now on a waiting list, and when we get the doses, we'll call them to set up an appointment.
Currently, the over 75s who don't live in care homes are able to come to vaccination centres. But ministers hope the new vaccine coming on stream will allow them to expand their strategy. In addition to vaccination centres like this, the French government says pharmacies are also going to be able to vaccinate people because the incoming AstraZeneca vaccine is easier to handle and conserve at ordinary drugstores. But the recent row between the European Union and AstraZeneca has implications at a local level.
On est vraiment en retard et la situation elle doit s'accélérer.
We are way behind. The situation needs to improve. Maybe we should put pressure on the labs to receive more doses and more quickly so we can speed up the process. It's taking too long and we are worried about how the variants could evolve.
Des nouvelles formes du virus.
The staff here are trying their best to follow the medical guidelines, but they're having to change their vaccination plans amid the wider uncertainty over the interrupted supply of doses, the spread of the new variants, the high daily case numbers, and a possible new lockdown.